Has this happened to you? You get your medical bill, and the charges seem like they came out of nowhere.
Yeah, so what if you could find out the prices ahead of time so you had a better idea of what your costs would be? 5 on your side, consumer advocate Jonathan Walsh has been digging into this issue. And Jonathan, one state really ahead of the game on this.
Yeah, as a matter of fact, but unfortunately, guys, it is not Ohio. My investigation has turned up questionable practices when it comes to medical pricing and transparency here in our area and in the state. And I'm not the only one who has noticed.
11-year-old Tyler Houghton from Strongsville loves the sound of his drums. But there was a time when he couldn't enjoy music as much. He was diagnosed with a tumor in his left ear.
I couldn't hear out that ear at all. I had to make people repeat what they were saying.
After a 7-hour surgery and a 20-hour stay at the hospital, the cost?
That bill totaled about $65,000 total. That wasn't the anesthesiologist, not the surgeon, any medications. It was just the hospital bill.
Aaron and Mark Houghton got numerous medical bills for Tyler. $7,000 plus here, $2,900 there, $9,800. Aaron says Tyler's surgeon did give them a ballpark figure for his services, but everything else?
It's like a crapshoot, basically. We had no idea what we were going to be looking at.
It's a pricing problem so prevalent, the state of Massachusetts, the first and only state, passed a law to stop it. Patients there can now go to their insurance company's websites, plug in their policy, and see upfront pricing. They can even shop around to see who will give them the best price.
It is a step in the right direction, and hopefully it'll help. Hopefully other states will follow through.
Pat Willis is a medical bill advocate. She helps patients look through invoices after the procedures. She finds mistakes in areas where she says costs are out of control. She showed us examples of her work. A bill for $160,000, she saved $112,000 of that. A bill of $36,000 saved $31,000. $50,000 saved more than $32,000. She even told a hospital administrator his prices were extreme.
And I said, how do you justify that? And he just gave me the answer is, because we can.
But can they? Our investigation found, according to the U.S. Department of Health and Human Services, there's something called UCR, usual, customary, and reasonable rates for medical procedures as outlined by individual states. The medical industry is supposed to be following prices that are reasonable for where patients live. But Pat tells us UCRs are being ignored.
If they enforce all of this, yeah, we'd be really good.
We asked Cleveland Clinic, Metro Health System, and university hospitals to discuss medical pricing transparency. Not one agreed to talk to us on camera. Metro does provide pricing to patients, but that does not take into consideration people's specific insurance policies. So these prices are not as helpful as the law in Massachusetts.
Massachusetts has always been on the forefront of being an innovator.
Ohio Representative Nikki J. Antonio is the ranking member on the legislature's health committee. We made her aware of what Massachusetts is doing. She tells us since everyone needs health care now, upfront pricing forces us to be good consumers.
Transparency in the pricing is probably a next step for us to understand.
She says she would like to look into the Massachusetts law and talk with local health leaders about pricing because her constituents have been vocal. People just like the Houghton family who say pricing transparency would give patients more control over their costs, and that would be music to their ears.
It should be something that's just out there. Why is it so secretive until the end?
Now, I dug up this report from the Catalyst for Payment Reform and Healthcare Incentives Improvement Institute. Now, both organizations are nonprofits that look at healthcare and payment reform. And guys, they grade states on pricing transparency. Get this, Ohio gets a big fat F.
Not good.
Not acceptable.
Wow. Nope.
Not acceptable at all.
No.
All right, well, hopefully things will turn around soon.
Yeah, that's what we're hoping as well. This will be a catalyst for that.
All right, we'll
Good
keep
job.
our eye on it. Thank you.
Jonathan, thanks.
You bet.